Students, ladies and gents, super excited today. I'm here with a former Eagle, Eagle Pride, and we're going to learn a little bit more about the wonderful Miss Mary Rabadi and her current profession, and hopefully just get a little insight into the transition between maybe from Sandburg to where she is now, and we'll learn some tips and tricks along the way. So, Mary, thank you so much for joining us.
Thank you for having me. What a great introduction.
Well, thank you. You are a wonderful student that always resonated with me. So it's super cool to just reconnect, first of all. But second of all, I just love to know, Mary, what is your job? And then if you could go into a little bit about like, what is it that you do in that job? Like, what's a day in the life like? I think that would be a great starting point for our students to kind of see where you're coming from.
Absolutely. So I'll start off with a little bit about me. My name
Please.
is Mary Rabadi. I am, as Mr. J said, a graduate of Sandburg. Go Eagles. Yes. Yes. And I transitioned from my high school career into St. Xavier University, where I did receive my bachelor's of science in nursing and a minor in psychology. And from then on, I graduated and studied for my licensing exam in order to practice as a nurse in the state of Illinois. So,
all right. So after you get your bachelor's, there's still like an exam you have to take to become a registered nurse?
Yeah. So after you receive your bachelor's, it was a 4-year program for me. 2.5 of those years was specifically for the nursing program. Okay. But after that, I know for myself, I took a few weeks, few months, I will say, to myself to kind of gather myself and enjoy that little break that I had from school. But yeah, essentially you do have to go back and study for a big exam at the end of it all in order to get your license to practice. Okay. So, and depending on which state that you live in America, so Illinois is one of the few states that you can get your license and exam, but only, or in Illinois, but only practice in Illinois, where other states offer, like California, I believe, if you get your license in California, you are able to practice in all states.
Oh, okay.
So, yeah, so it's nice. But yeah, that is one of the things that you have to do in order to legally practice.
Oh, that's great to know, Mary. In case someone's interested in being a nurse but goes to school out of state, they still have to take that in-state test eventually for Illinois.
Correct, yeah.
Okay.
Yeah.
Great. All right, so you do that, you pass that, and now you're entering the world of the front lines and helping others. Could you tell us, like, what is that? What's your title for that? What do you do? We'd love to hear about that.
Yeah, so as a registered nurse, I do work on the cardiac telemetry unit, and I will say it is one of the most interesting times to become a nurse during a global pandemic, but it is a privilege to say the least. A typical day in my job is, I will say the COVID numbers did go down, thankfully, but it was at an all-time high when I did first enter a few months ago. So it was interesting trying to transition again from being a new grad, not really knowing as much about the nursing world, hospital world, in a sense of it all. So trying to get a hold of all of that while still trying to learn what nursing really means, how to care for patients in one of the most vulnerable states that it can be put in, dealing with everyone from different, like every walk of life possible, dealing with different departments, whether it's doctors, the pharmacist, dietitian, case managers. So trying to navigate that all is, still is, I will say, is still one of the challenges for me, but it's getting better. And I will say that that is basically how my day goes. So I go into work, I clock in 6:45 in the morning. With nursing, it is 3 12-hour shifts a week. So I do have 4 days off, which is a bonus. But I start my morning off by getting report from the night nurse on typically 4 to 5 patients is our nurse to patient ratio at least my hospital. I work at Silver Cross in New Lenox. Okay. So yeah, that's how I start my day off, and they could be more critical. So I have to prioritize my day in the sense, like I have to go see this patient first, get their medication ready, check their vitals, talk to the doctor, and then kind of plan my day throughout that. So doing that for 4 to 5 human lives, I will say that is that's kind of how I plan my day and how my brain typically works. So yeah, it's fun, it's great. Again, it is a privilege. So
yeah,
I'm still learning.
So you have a lot to do during the day. Is it a lot of like back and forth. You're bouncing from one to the next and then back and repeat.
Yes, absolutely. And I know 12 hours sounds like a long day, but I promise you that those many hours fly by fast. Like I blink and the day is over.
Wow.
Because there is so much to do within that time frame. And again, you're caring for an actual human life. Like you don't want to make a mistake. You want to be very thorough. I still ask questions all day. Like even with my 4 years of experience in school, there's still so much to learn, and you don't, in my opinion, truly learn until you take what you learned, the information in school, and actually apply it to the real world, into a real scenario rather than on paper. So that again it is a lot of back and forth, talking to the doctors, making sure our medication is appropriate to give with the pharmacist, making sure their diet is aligned with what the dietitian wants for them. So I'm dealing with a lot of interdisciplinary departments. So
wow.
It's good. I'm learning a lot from everyone that I encounter.
Sounds like your job entails a lot of communication. Is that fair to say?
Yes, it does, for sure. So
awesome. Well, thank you for kind of sharing a day in the life of that. So you are on, you said, a cardiac floor.
Correct.
Is that something you were able to choose, or is that like when you apply for a job, is it does that take specific training for cardiac versus another? Is that something you learn on the job? I know like there's is there pediatrics floors and different floors in a hospital?
Yeah, so each unit in the hospital, whether it's pediatrics, I can't even pronounce it. Basically labor and delivery, like postpartum, mother, baby, or the psychiatric department, the cardiac floor, emergency room, intensive care units. So there are multiple different avenues you can take in nursing. And in school is really where I learned what best suits me and what I wanted to continue on and with my career. So in school, we do get introduced to those different units through our clinical rotations. And for me, I thought I always wanted to work with kids. I love kids. I think they're so cute, being to care for them. But as soon as I stepped foot onto that pediatric unit, I'm like, this is not for me. Yeah. But again, I progressed in school, and everyone would always ask me, like, Mary, like, what do you want to do? What kind of nurse do you want to be? And I always answered with the same question. I truly won't know until I finish all of my clinical rotations. So I was placed on a cardiac unit, which is, again, specializing in the heart. All patients are hooked up to a telemetry monitor, which shows their heart rhythm on a main screen in the nurse's station, which you do get certified for while you're on that unit. So nothing that I really had to prepare for, in a sense, before applying to that specific unit, to answer your question. But other units like the emergency department or intensive care unit, also known as the ICU, do require more experience before entering on that, because they're care for more critical patients. So yeah, it's basically what you choose to do, and you can grow to that point. If, say, I wanted to work in the ICU, I can, with a year or two of experience on the cardiac unit, I can move to the ICU or emergency department or pediatrics or all of the above.
So that's nice. You do have options to move around if you want to try new or learn new things. Yeah. And it sounds like there's a lot of learning on the job as well.
Oh, of course. Yeah. And that's the beauty of nursing. You never stop learning. There's always a new medication, a new procedure, a new disease, that COVID, there's always something new to learn about. So that again, like I said, is the beauty of nursing. You never stop learning. I learn every day. I never stop asking questions. And the more you learn, I think knowledge is power, education is power. And for me personally, I never want to stop learning. I've always loved school. I've always loved bettering myself, especially in order to better my patients, whether that be through certifications, advancing in my education, and getting a master's or a doctorates in nursing. So those are definitely all goals for me in the future. But that, again, that's what's great about nursing. There's so many different paths you can take.
Well, first of all, as on behalf of myself and the class, thank you for being on the front lines and helping people every day. That is a selfless job that probably isn't thanked as often as it should. So thank you for doing that, Mary.
Thank you for that.
And then also, I would love to, since our students are listening, looking back or now even, do you have any tips, suggestions, or skills or anything that you would suggest students acquire, practice, look into that might help them not only necessarily in this field, or it could be specific, but anything in general that you wish you would have known or that you think is something valuable that they should consider now to help life a little bit later?
Yeah, absolutely. I was in their shoes not even 5 years ago. I was sitting in your classroom too. So I kind of
Sorry
know
about
what's
that.
hey, that was a great class. I miss it. But I will say, like, I already know what's kind of going through their minds at this point. Again, I'm only a few years older than you guys. I feel like I'm getting old, but no, I remember already having an idea of what I wanted to go into, what kind of profession that I wanted to pursue, but it's okay if you don't. I think that's what college is for. That's what the resources around you are for, is to get to know what you like and what you want to do with your life, whether that be through networking, if you have an adult in your life, or a teacher, or a friend's parent that works in a profession that interests you. Get to talk to them, like get to see if you can shadow them for a day. Like my mom, it's thankfully she is my inspiration, and I get to live with her. So she is a nurse as well. So I kind of got my taste of nursing from her. She would come home with the most amazing stories, and I'm like, wow, one day I want to have those stories of my own. So that was it for me. And I think even just getting a job, and essentially not even something you want to do long term. Like I held a student supervisor at the athletic center at St. Xavier, which had nothing to do with nursing, but it was something that I was still able to build a foundation on and really practice customer service skills, communication skills, leadership skills, getting to deal with people from every religion, race, like everything that you will essentially have to do in the future with any profession that you go into. So just getting out there, taking advantage of any opportunity that you get to learn and just to be a part of essentially the real world is good. So
I love that. I think too, what you brought up, just to highlight again, the idea of the transferable skills, you helping out in the athletic center, you're right, isn't necessarily something people would say would directly relate to nursing, but dealing with people, customer service, and those skills you learned and kind of nurtured there benefit you years later in a different job. So that those experiences and trying new things, I agree, is so beneficial. Thank you for bringing that up then as well. I have a lot of students that are interested in the sciences, and that's why they get stuck with me. A lot of them end up having the world of the medical world on their mind, whether that's nursing, being a practitioner, being a doctor, or that. So this is helpful to just see one avenue to go. But with that being said, unless there's any other pieces of advice or wisdoms or shout outs you wanted to make, I think we did a great job talking through a day in the life and where we go in that. Is there anything else left you wanted to mention before we call it a day?
Enjoy your time in high school. Take advantage of everything that you can. Be nice to Mr. J. He's a great teacher. And one last thing I will say, your health is the most important thing. And I witness it every day firsthand, what it can do to someone. So again, take care of yourself. When Mr. J says your body is your temple, he really means it. So those are my final words of advice.
Well, thank you. Well said. And you're right. Your health is your foundation to do everything better, including making the world better. So well said. And sometimes we overlook that when we're thinking about our careers. So thank you for that. So, well, Mary Rabadi, it's been an absolute pleasure. On behalf of myself and my students, thank you for your time. And we're sending you nothing but health, happiness, and patience during these unique times, and hopefully
so much.
our normal times, and onward and upward for you. I'm excited to see how you continue to grow and learn and take it to higher places. So thank you, Mary.
It was my pleasure. Thank you for having me.